I just want to end with mentioning two medications. When I wrote the Babesia foundational textbook in 2006, which has every new discovery in the last 2 years, I mentioned two medications. One was Primaquine, which has been around for a very long time, I think well over 100 years. And while that doesn't last a long time, it doesn't last like 3 days in the blood, it's been used on vast numbers of people for both malaria, and it's useful for Babesia. Now, this medication and the other one I want to mention, Tafenoquine, you need to have a lab done before you try these. And I suggest anybody with Lyme always gets this test. And I have never seen anybody with just Lyme. I've seen smart people think the patient had just Lyme. And then I do things like kill some Bartonella and kill some Babesia, and then 6 weeks later, the antibodies are positive. So the lab you have to get for these two medications, and also Dapsone, which has been around quite a long time, some people feel adds to our effectiveness at killing some things, is a G as in God, 6, T as in Paris, D as in dog, G6PD. If you're seeing somebody that feels they can treat your Lyme and they don't know what that test is, run. That means they know nothing about the treatment of Babesia and they don't understand the importance of that blood test. You must be normal on that before you try things like Primaquine or Tafenoquine. So let's talk about Primaquine. So it's 26.3 milligrams, and it's also called 15 milligrams, but it's the same pill and they're fairly small. So if you're feeling pilled to death or you're tired of drinking things like a Tobacone that tastes like yellow paint, it's a nice option. So I would start with a half of one for a week. If you don't feel anything on that, I'd do one for a week or two. Then I would do 1.5 a day and maybe one in the morning, half at night. Do that for about a week to 10 days. And then I would do one in the morning and one at night. That way the blood level is smoother, and some people go higher. I won't tell you if I'm one of them. And it's a very good medication. If you have to pay cash with good RX, it's about $50, $75 for one a day, and that would be $30. It'd be $100 if you're doing 2 a day. And the thing about it is, please do not think anything is going to cure you of Babesia in like 10 days, 2 weeks, or something like that. What's very clear when people are saying that is they never look at serial slides with a excellent microbiologist that can see whether Babesia is gone or not. And it's clearly not gone on all the standard treatments of Babesia you'll find in like a little medicine book, or if you just put Babesia treatments. All those treatments are so obsolete, and I addressed them in 06 and following. But why read Babesia textbooks when you're treating Babesia? I just cannot understand. They don't read them. They absolutely don't read them, because they're advocating to basically the whole world dosing that I proved failed a very long time ago. Okay, now in this 06 Babesia foundational textbook, that's still #1 on the planet, we say, hey, keep track of this drug Tafenoquine, and we gave the number and the code to track it. And then in recent years, it became available around the world, including the United States. And one of the benefits to it, for example, malaria, is the blood level lasts quite a long time. We'll say roughly a week. So if babies are coming out of a red blood cell, let's say they're bursting and 2, 4, 6, or 8 are coming out, there'll be Tafenoquine there to kill them. It's not like the drug is going to go way down and allow them to survive and enter other red blood cells. So that's one reason that after 60 years with no new malaria drug, a lot of doctors, understandably, are prescribing it. So if you live or you're visiting one of the 50 plus countries that have a lot of malaria, you may be given this, and I understand why. Tafenoquine is said to be a once-a-week medication. The very few people in the world that are helpful to me are not using it once a week. They're using it like I do 2 or 3 times a week. And the dose often is 450. Whether I or they go over that, that's for another time. It is not curative alone. So like Lyme that has 4 forms, the active, the nut, the frozen, and the biofilm protected one, you need different treatments for those 4. And like Bartonella, Zhang's research showed, the more treatments, the more effective the killing. And that's what we found years ago. And the same is true of Babesia. The more treatments at the higher doses, the more likely you are to be cured of Babesia. I want to leave you with one last nugget that we mentioned in our November 2023 book on herbs and essential oils to kill Lyme, Babesia, and Bartonella, and that's garlic essential oil. Now, there are many oils that come from garlic. One is made by Nature's Way. If you poke that, open it up, it will not burn your tongue. There are others that you put them on a Q-tip and put them on your tongue. They will burn for 6-8 seconds, and it goes away. But there are really strong, volatile essential oils. And we report research that is very effective at killing Babesia. But you don't hear about it, and we were lucky that we came across it. And combining garlic volatile essential oil, which you're going to want to mix with something to calm it down. I actually was afraid of it when I first smelled it. So you want to thin that down with coconut oil or whatever healthy oil you prefer. And then you can add some of the medications we mentioned in other talks to see about curing your Babesia. So that's it for today. And thank you for your attention. Bye-bye from Florida. I'm Dr. James Schaller.
I wrote the first Bartonella textbook in 2008, but this new one will be authoritative for many years.